My name is Jillian Morris, and today I will be proposing a series of modifications to the government's Canada Child Benefit Program in order to mitigate its negative unintended health impacts. The Canada Child Benefit, also known as the CCB, is a tax-free monthly payment provided by the Canada Revenue Agency to eligible families raising children below the age of 18, and it may include the Child Disability Benefit and other similar provincial and territorial programs. This policy aims to reduce child poverty, and recipients eligible for its administration must meet various criteria, such as one partner possessing Canadian citizenship. The CCB's monetary value is determined from the family's number of eligible children, province of residence, and net income, and individuals must file their tax return annually to remain eligible to receive the CCB. The negative unintended health impacts pertaining to Indigenous peoples from the CCB include distrust of the Canadian government due to their history of assimilation and residential schools. This distrust leads to a lack of benefit uptake by Indigenous peoples, as 36% of Indigenous peoples do not file their taxes. With 50% of First Nations children living below the poverty line, a lack of uptake of the CCB can leave eligible families without necessary financial aid. Additionally, the CCB does not consider the high cost of living in northern Indigenous communities when calculating each applicant's benefit. The elevated cost of food due to poor transportation infrastructure and high food transportation costs can result in the CCB's funds being insufficient in covering the entirety of a family's housing and food needs. To mitigate the negative unintended health impacts caused by the CCB, the following modifications to the policy are proposed: increasing CCB take-up rate, increasing the CCB's distribution of benefits, and publicizing the CCB as a social objective. The first proposed modification to the CCB is to increase its take-up rate. In its first year, 12% of eligible families did not apply for nor receive the CCB. Families who fall within this 12% are often the most vulnerable and in need of benefits such as the CCB, and they often lack access to resources and information surrounding the CCB criteria, application process, and benefits it can provide. There are various marginalized populations that may be unaware of the CCB, such as those living in shelters, low-income Black families, and Indigenous families living remotely or in northern communities. Indigenous families may also be wary of filing taxes due to a history of distrust of the government. By increasing the take-up rate, more eligible families can be reached. This can be done through increasing awareness of the program, encouraging clinicians to get involved in helping families navigate the application process, and providing online and physical resources, such as brochures, to vulnerable families to inform them of the many benefits they could gain from the CCB. This modification would help mitigate negative unintended health impacts by combating Indigenous distrust of the government via providing transparent information about the benefit, as well as reducing food insecurity in northern Indigenous communities by increasing the amount of CCB-related funds received by eligible families. The second proposed modification to the CCB would be to increase the CCB's distribution of benefits. The CCB can more effectively reduce child poverty by factoring in cost of living and the applicant's location when determining the monetary amount of the benefit to be provided to each applicant. The CCB's monetary value is determined by various factors, such as the applicant's number of eligible children and their ages, their adjusted family net income for the base year, the child's eligibility for the disability tax credit, and the province of residence of the applicant. Though factoring in the province of residence contributes to the consideration of the applicant's cost of living, there is still a high level of variability in cost of living within the same province. An example of this would be comparing the average cost of living in Toronto, which is much higher at an average of $61,654 to $83,680 a year needed for an individual to thrive, compared to that of smaller cities such as Belleville. This supports the need for greater consideration of cost of living when determining CCB amounts. Indigenous families are also greatly impacted by high costs of living, such as high costs surrounding food and housing in northern communities. By factoring in cost of living when determining CCB distributions, these negative health impacts can be mitigated. The third and final proposed modification to the CCB is to publicize it as a social objective. By making the CCB a social objective, it encourages Canadians to take pride in supporting what is considered to be the number one resource of a nation, children. By investing in children, Canadians are investing in ensuring the upbringing of future citizens, workers, and taxpayers. Child poverty has severe social implications and can lead to an increased likelihood of delinquency and risky behaviors, worsened mental and physical health, increased instances of harassment and bullying, and a decrease in educational attainment. The CCB supports the upbringing of healthy, intelligent children by aiming to reduce child poverty through providing families with additional funds for nutritious food, proper clothing, hygiene products, and more. It also contributes to all children receiving equitable educational opportunities, secure housing, and adequate nutrition regardless of their family's household income level, location, or race. In order to gain public support to publicize the CCB as a social objective, this proposal can be incentivized by the Government of Canada combining this objective with additional childcare support for families, such as free or subsidized early childhood care. This modification would help mitigate food insecurity and housing concerns in low-income families, such as Indigenous families in northern communities, by reducing the stigma surrounding poverty and benefit use, increasing CCB uptake, and garnering community support for those in need. Overall, these modifications would improve the CCB by increasing the amount of families receiving the benefit via increasing the take-up rate, improving the allotment of the CCB's monetary amounts to better support families in areas with a higher cost of living via improving the distribution of the CCB's benefits, and improving community support and engagement by publicizing the CCB as a social objective.